I had a consultation and I was offered to do a skin tightening, Pelivay, which is, I found very, very impressive. After it was done on the 1st of December, the first 2 days, already I saw the big difference. It was not noticed by not only my friends and colleagues and my husband. I was looking in the mirror and I was told myself, wow. A very thin skin under my eyes, on the lower eyelid and upper eyelid, and also the skin under my chin and on my forehead that was thinning just month after month, more and more. Also, I was losing collagen. The breakage was very intensive last 2 years. Pelivay is amazing procedure. It's fast. It's only 1 hour. It's very, very, very reliable, particularly for people whose skin is thinning, who loses collagen, who work many hours and come home and look in the mirror and say, oh, I look old. You don't say this anymore.
Hi, my name is Kristen Campbell. I'm a registered nurse at Dermatology Institute of Victoria in South Yarra, and today I'm going to talk to you about the Pelivay. So we'll start by preparing the patient's face with a deep clean. This is a great 30-minute procedure. It's quick and it's painless and doesn't require any anesthetic. So we start the procedure by placing a grounding plate on the patient's back. So can you lean up slightly for me? So the next step is to apply a gel on the skin, and that's to help the handpiece glide evenly and smoothly over the skin. So the Pelivay is a radiofrequency machine. It uses heat to cause the body to naturally reproduce collagen and tighten elastin tissues. Pelivay works by heating up the skin to 40 degrees. As you can see, before we start out the treatment, this patient's skin temperature is at 28 degrees Celsius. So we'll start the treatment right now by using a handpiece. This tip starts out cold and eventually will heat up the patient's skin. So I'll move in circular motion to eventually heat up the patient's skin to about 40 degrees Celsius. At 40 degrees is where the body's collagen will naturally denature and more will be produced. The patient will require about 4 or 5 passes depending on the area treated. And so now we're going to check the temperature of the skin. And as you can see, it's the perfect temperature for remodeling, 41 degrees Celsius. Pelivay is ideal on the face and on the neck. We can also treat right up under the eye area where the skin's more sensitive to help tighten those fine lines. So now we'll begin treating under the eye, which requires a smaller handpiece. So the head on this handpiece is much smaller, which enables us to treat smaller areas. Under the eyes, the treatment will take about 15 to 20 minutes. The full face will take about 30 minutes. And if we do full face and full neck, about 45 minutes to an hour. Pelivay is ideal for people who want to delay the aging process, but they're not quite ready for surgery or they're not interested in the downtime associated with surgery. Immediately after the treatment, the patient will look rejuvenated and hydrated. It's perfect to do right before an event. This is a painless procedure, so during the treatment the patient feels a heating sensation, but it's actually very calming on the skin. So we'll finish off this procedure by applying a vitamin C, which is a potent antioxidant, and it also will help to build collagen after this treatment. Next we'll apply the TNS Essential Serum, which is a growth factor. Growth factor is anti-aging. It's going to help with plumping the skin, hydrating the skin. Because Pellevé is non-invasive and has no downtime, many brides come in right before their wedding to have a treatment.
Grail of aesthetic medicine has often been the problem of pigmentations. Pigmentations on the face. We get pigmentations on the face from melasmas. Melasmas are pigmentations after pregnancy. We get pigmentations from sun damage. Freckles we are born with. Sometimes with laser treatments or fractional treatments which are too strong, people get pigmentations. Pigmentations from old acne. Also, problems like acne scarring, unevennesses in tonus of the skin, and little wrinkles are a big problem. Well, how can we fix these without having Botox, without having dermal fillers? Well, I have often said the holy grail, the answer to pigmentations is a definite Obagi new derm. To go a little bit backwards, Dr. Zain Obagi, he's an American dermatologist, all the way back 30 years ago devised this concoction of about 8 or 9 different medical creams to banish pigmentations. He was using them to treat the skin of color in America. Very soon, people heard about this miracle cream, but he wasn't giving away his formula at all. After a while, there was pressure onto him. Apparently, so the story goes, he sold the formula to 2 dermatologists for £1 million each. Allegedly, I must say, but it's an interesting story. Very soon, the word was out, he gave many courses, and Obagi New Derm was born. By applying the creams at home, we are starting to see the results with every week. The treatment lasts 3 months. We apply the creams every morning and every evening through a strict instructional manual, which you also get at home. And even though you get a little bit of dryness, a little bit of redness, a little bit of flakiness, with strict instructions from your medical team at the Milo Clinic, and through just applying some mineral makeups like Jane Iredale makeups, we can cover this. And what's amazing, with pigmentations especially, they're all gone. After about 3 months, they will go. In some rare cases, people have to buy a second box and they will have a 6-month treatment. And even an Obagi blue peel, a chemical peel in the between, is sometimes needed. Or I've got to say, in 95% of cases, just the creams will banish the problems, including pigmentations under the eyes, pigmentations on the top lip, pigmentations around the eyes, pot marks from acne, unevenness in the skin, small wrinkles. The results are amazing. And because the stratum corneum, the thick layer of skin on the outside, is something which regenerates so slowly, it takes 4 to 6 weeks to regenerate slowly. And it's like a diary. When we've burnt in the sun, when we've been pregnant, when we've had acne, these little marks, blemishes stay. They never go away. And with Obagi, we speed up this regeneration process, and we're getting brand new collagen coming to the top, and that shine to the skin which we lost in our teens practically. Strict medical follow-up by our team is very important. So if something is too red, we can reduce the dose. If things aren't happening at all, we can increase the dose. But what's most important with the Obagi New Derm, with the problems I've listed, and especially pigmentations, the results are guaranteed. Depending if we have the normal to dry set or the normal to oily, with the normal to dry, we start with a gentle cleanser, or with the normal to oily, we start with a foaming gel. This is a liquid soap. designed to remove makeup and to deeply cleanse the skin and prepare the skin perfectly for the rest of the Nuderm system. Secondly, we move on to the toner. The toner is an alcohol-free, non-drying toner which adjusts the pH of the skin for increased penetration of product ingredients. We use after cleansing by saturating a cotton pad and gently wiping over the entire face and not rinsing off. We swiftly move on to number 3, which has hydroquinone in it. It's a gentle yet effective prescription strength hydroquinone which helps to correct the appearance of age and sunspots for a healthier and more even complexion. The usual dose when we start with Auc Nuderm for Clear is half a gram, which is a pea size. In the morning routine, we then carry on to Exviderm or Exviderm Forte for normal to dry or normal to oily skin. This is a glycolic peel or a phytic acid peel at home. So it's a gentle sugar peel at home. Again, we do a half a gram usually, which is a pea size. In the morning routine, we skip phase 5 and we move on to Auc Hydrate, which is a brilliant Auc moisturizing cream to be used as needed to soothe areas of dry and flaky skin. In the morning, before we go out, we have to finally use a Sun Shield Broad Spectrum SPF 50 by Auc. To go back a step, in the evening routine, we repeat stages 1, 2, and 3. We skip stage 4, but as we can see here, the most important stage is stage 5, where we mix the blender, half a gram of pea size, and then we also put tretinoin, half a gram pea size, onto the hand. We blend the two creams on the hand and then we apply the cream onto the face. As with all the other active creams, which are 3, 4, 5 and tretinoin, we start from the most problematic areas, pigmentation or acne scarring and so on.
I warmly recommend this treatment to everyone.
Finally, Auc cosmeceutical range. So we've just talked about Auc Nuderm, the medical range, which can fix lots of unhealthy problems on the skin, things like the pigmentations. But the Auc cosmeceutical range, in my mind, is possibly the second to none cosmeceuticals range on the market. You know, the range is quite simple, but it's fabulous. You know, once we've fixed your skin, once your skin is looking great, we need to continue that treatment. In fact, after every Botox and filler treatment, everybody should be using some sort of cream, and I highly recommend Auc because it's got a medical base, it's not just a cream. Starting with the Elastoderm eye cream, I have a patient here in London. She's a very discerning customer, she knows what she likes. She claims this to be the best eye cream she's ever tried of all the creams, and many of our customers say that. So it's an eye cream, it's a protein complex which improves elasticity around the eyes. Anybody who has a tear trough treatment with us, it's highly recommended. In addition, vitamin C serums from Auc, we have a 10, 15 and 20% serum for sensitive and non-sensitive skins. This is an amazing vitamin C serum. It acts as an antioxidant and it feeds the skin, it rejuvenates and protects the skin. In fact, these first two creams, i.e. the Elastoderm cream and the Auc vitamin C serum, are also things which we can buy. If the Auc Nuderm is causing too much redness on the skin, these two improve the dryness around the eyes and improves the redness during the Auc Nuderm treatment. Finally, our two old friends, which we've already seen in the film, which are part of the Auc set, but actually individually, they're two of the best creams money can buy for. Number 1, the Factor 50 by Auc. I recommend to anyone who's jetting off into the sunshine. It is the perfect factor to rejuvenate the skin, to protect the skin, to protect it from the harmful sun's rays. Finally, the Auc Hydrate cream is possibly the best hydrating cream on the market. Finally, I highly recommend and wholeheartedly recommend the Auc Nuderm medical creams and the Auc cosmeceutical creams.
You get like a glowy look. And then within a couple of days, I see that the skin just looked and felt tighter. With Pelave, what I like about the eyes is that there really aren't much injectables that you can put in there. And this took away the circles under my eyes, and it made them, the wrinkles have gone away. I actually just had lunch with a girlfriend who hasn't seen me in a while. She's like, "You look so young. What have you been doing?" And I said, I haven't been injecting.
Well, if you've already had too much sun and need some help turning back the clock, I want everyone to listen up because dermatologist Dr. Ava Shamban is back in our procedure room with a breakthrough treatment. This sounds exciting.
It's extremely exciting because one of the things that happens, and certainly whether you've been in a tanning bed or had too much exposure to sunlight, is you start to notice changes in your eyelids, in the development of crow's feet. So what can we do? Well, we have a new procedure using this radiofrequency device called Pelave that helps tighten the upper lid, is going to give Sharon a little lift. We want to make those eyes sexy and youthful again. Yes. And that's what we're going to do today with the Pelave. And the great news is we're going to be able to see an instant result, even though it will require several treatments.
All right, before we see the results, let's see how Pelave works. So in a woman like this, what's bothering her? Those wrinkles around her eyelids, so-called crow's feet from squinting in the sun. What happens using Pelave? Heat is distributed into the dermis, the deeper layer of the dermis. What happens? A couple things. Stimulates new collagen growth and rearrangement of collagen. Skin tightening, which should help soften those crow's feet, those wrinkles. And we'll see the results later on.
Ooh, excited.
So, Dr. Shamban, we can see you're getting started. We're going to check back in with you later to see the results. If you're looking to recapture a bit of your youth, you've come to the right place. Dr. Worden and dermatologist Dr. Ava Shamban, they're back in our procedure room. They're going to show you how you can take years off your face in less than 1 hour.
This technology was so fast that Dr. Shamban was able to do this for Sharon while we were doing the show. And we're going to reveal her results now. But let's just refresh our memories what was going on when we did this Pelave. It's a new machine that generates heat. It puts that heat right where we want it. What it's doing is tightening that tissue, raising tissue, and also helping to promote new collagen growth. So before we show Sharon, let's take a look at the way she looked before the procedure. And now let's take a look at Sharon now. Look at that.
Wow.
And Sharon, how do you feel?
I feel terrific. It's amazing. I can open my eyes wide now. And
you know, Dr. Shamban, I think that's where I see the biggest improvement. I know you treated all around the eyes, improvement in the crow's feet, but I can see the hooding of her upper eyelids and her brow is up.
Absolutely. She got at least a 2 millimeter lift here in the brow and even a couple millimeters in the lid. And the good news is she will have a series of 3 to 5 treatments and she'll see continued results.
That's fantastic. How long does it last?
Well, this will last. She'll have a series of 6 treatments, and then in a year, she'll have another 1 or 2 treatments because each time you do it, you stimulate more collagen. And we want to bring her back.
Good stuff. Well, thanks, Dr. Shamban. Good luck to you, Sharon.
Thank you.
It's like just relaxing. It's almost like going to a massage, you know, and you just lay in there and she's just massaging your face. My results have been phenomenal. My skin has been tightened. Everyone is wondering what I'm doing because they constantly tell me, you don't need the injection, but I don't tell them what I'm doing because that's the secret. Girls have to have secrets, you know. So, but it just looks wonderful. And plus, you know, it eases you into it. You know, people see you and they say, oh, you look great. You know, and that's what I want. I want the natural feeling. You know, I don't want to look like my skin is too tight. You know, I just want to grow gracefully.
Hello, I'm Michelle Stringer, the Director of Marketing Communications at Obagi Medical Products. I'm here at Obagi headquarters today to talk to you about the Elastoderm Eye Complete Complex Serum. The Elastoderm Eye Complete Complex Serum is the latest addition to our clinically proven family of Elastoderm Eye products, which include Bimineral Complex and malonic acid. These two ingredients together have been shown to improve the appearance of fine lines and wrinkles around the eye. The Elastoderm Eye Complete Complex Serum, which includes caffeine, is delivered via a unique stainless steel rollerball system, which gently massages that sensitive skin around your eye as you apply the product. Because the stainless steel rollerball assists in reducing the appearance of puffiness under the eye, I'd like to show you how to apply the product. We recommend using it only under the eye and starting at the outer corner. You'll want to make 8 small circles all the way in to the corner of your eye. And if there's any extra product, you can just pat it dry. And then I personally use the Elastoderm Eye Cream afterwards, and I'm ready to start my day. We hope you enjoy the new product.